I'm going to clearly explain vaginismus and how to cure it in just 15 minutes. My name is Dr. Janelle. I'm also known as the Vagina Rehab Doctor on TikTok, Instagram, and obviously here on YouTube. And I want you to be free from vaginismus without it taking a year or going to pelvic floor therapy for months and months on end. All right. So, what is vaginismus? Vaginismus is a pelvic floor muscle disorder that typically involves the muscles that surround the vaginal opening and the muscles deeper inside of the pelvis. When these muscles become too tight, it can make insertion completely impossible. Okay. And here's the thing you really need to understand: vaginismus is not an automatic muscle spasm. That has been disproven since 2014. And it's actually been shown that vaginismus, if you're struggling with penetration, intercourse, or just pain-free insertion of like a tampon or a finger, this is happening because one, your pelvic floor muscles are too tight. Two, you may be holding anxiety, fear, or distress with insertion. Maybe you're afraid of pain. Maybe you're afraid of your vagina. Maybe you're afraid of sex, right? And then number three, there is usually pain involved. So when someone tells you it's just in your head, or you just need to drink a glass of wine, or you just need to try relaxing more or having more foreplay, that's not the answer. Vaginismus is a medical condition. And the reason why you may be struggling with impossible penetration is because of one, significant pelvic floor muscle tightness. That's curable. We can fix that. Two, fear or anxiety with insertion. That's curable. We can help you move through that. And then three, pain. If there is pain when you're trying to get something in here, let's say you're trying to have sex and bam, 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 it's just hitting a barrier each and every time. That is your pelvic floor. There is no brick wall, by the way. The brick wall that you may be feeling when you try to assume insertion or sex is actually your pelvic floor muscles. Now I'm going to demonstrate exactly what's happening here. So let's say you're turned on, you're having a hot, steamy night, you're ready to have sex consensually, you're excited, and you go to try, and it feels like there's no space. It feels like there's just a wall there. He can't get in. What's going on? Should we just keep pushing harder? Should we stop and do more foreplay? Let's just add a ton of lube. Yeah, let's do that. Let's add a ton of lube. It's still hitting a brick wall. There is no actual brick wall, right? The brick wall that you're feeling is the barrier created by your muscles that surround the vagina that are too tight. We open up those muscles, and now there's a clear pathway. It's buttery insertion. It works just fine. So I'm going to share with you some things that you can actually start doing to cure your vaginismus. Vaginismus, again, is a condition that can make insertion of any kind, not just sex, okay? Sex is one part of life, okay? You may have found out about your vaginismus at 12 or 13 years old. You're not even trying to have sex. You're trying to put in a tampon. And it hurts so bad trying. It feels impossible. You're reading the instructions a ton of times. This is vaginismus. So impossible tampons are severe pain with it. Impossible pelvic exams are severe pain with it. Impossible finger insertion are severe pain with it. And impossible sex with someone you feel ready with. It's not that you're scared. Your body is just saying no because it doesn't have the space available for that penetration, for that insertion. Okay, so what I want to do is I want to tell you exactly how you can go from afraid of sex, running from dating, not able to get pregnant because sex is impossible, to your relationship is spicy, your depression is gone, and you're pregnant because sex has become easy and not a chore. I'm gonna tell you that now. The first thing that you need to do is understand that this is treatable. Listen, if you keep walking around with the shame and the guilt and the attitude of being defeated, you will remain defeated. As a man thinketh, so is he. As a woman thinketh, so is she. As you thinketh, so are you. You have to get your mind and your pelvic floor on the same page. Guess what? Your brain actually tells your pelvic floor, my hair is getting so poofy on this side, keep getting distracted by it. Your brain tells your vagina what to do. How does it do this? By your nerves, okay? So your nervous system is a big part of this. And here are some signs that your nervous system needs help, right? Being retrained. You're clenching constantly whenever you try to insert something. Or maybe just through the day. You're at the desk, you're clenching your pelvic floor muscles. Why is your vagina clenching? Because your nervous system is on edge, right? When you try to go to have sex, you're guarding, you're clenching your thighs really tight, you're panicking, you're getting scared. Nervous system. Your nervous system has to help you get used to things going inside of you without feeling like there's a siren going off. Okay? And this is what we do when we work with you one-on-one. We actually teach you how to calm your nervous system when you are using dilators, when you are inserting your finger. Because sometimes talking through your pain and talking through your fears or talking about why sex feels like just a duty and a failure each and every time can be helpful for your mind, but it's not always very helpful for the actual muscles that need to open up, right? So mental health therapy is crucial. It's important. For a lot of people, it can make a big difference. But at some point, we actually have to help you to embody your healing by physically working on your nervous system, how your muscles behave. Are they relaxing or are they clenching? Are you feeling scared or are you feeling relaxed? Is your pain being hyperregulated because you're so fearful? Or is your pain being communicated in a way that's actually correct, right? You feel this mild pain that you can actually resolve and bring down, right? That has to do with your nervous system. So one of the first things is to, for sure, start believing that you're able to do this because your brain talks to your nerves and your nerves talk to your pelvic floor. So if you think that sex is impossible, you're probably going to show up feeling that way. If you feel that you'll never be able to insert a tampon, you probably will be clenching and guarding and squeezing so tight that the tampon can't get in, even if you did have the space in your vagina. So one, you have to get your mind in a place of abundance. There is enough healing available for every person who has vaginismus. And that healing includes you. That abundance includes space for you specifically. And this is one of the affirmations that I like to teach our clients. Vaginismus is curable for me. Vaginismus is curable for me. Not her, not them, but me. And once you start to believe that and recite that, it will then impact the actions you take. It will impact the calls you make. It will impact the dilator you pick up. It will impact the way you show up in dating because you know this is not your life story. You know that this is just a chapter. Okay? The next thing that you need to do is you need to actually help yourself to retrain your pelvic floor muscles. And this is where I can really help you. I am a pelvic floor physical therapist who specializes. So what this means is that I don't do incontinence, I don't do prolapse, I don't do pregnancy, I don't do postpartum, I don't do this, I focus in on one thing, which is vaginismus and or sexual pain. That's it. That allows me to get good because I'm focusing. I'm able to increase my experience with one condition. And so I am a pelvic floor physical therapist, but one who actually specializes in vaginismus and in telehealth. I know that may sound crazy, but when I actually left being a pelvic floor therapist in person and started working independently on my own, seeing people all around the world, India, Australia, Ghana, South Africa, Canada, LA, Chicago, I started to notice that you need less time than in person because you're actually given the tools of how to use these things strategically. You're no longer given tools with absolutely no guidance. You're given tools with strategy. So in each session, we're teaching you how to move through that burning and stinging pain at the opening, what to do when the dilator is getting stuck. It can't go in further. Why it's hurting when you remove the dilator. What's that? How to move your hips and calm your nervous system. What to do if you're feeling scared. So in each session, we're doing that in each session. And so if you just want to learn our 5-step process to helping our clients go from impossible penetration to easy and buttery sex, then I invite you to check out my free webinar called the Vagina Rehab Doctor 5-Step Process to Pain-Free and Pleasurable Sex. This is completely free. This is where I break down exactly how we help our clients in just 8 weeks conquer vaginismus and get their vaginismus cure. It's only 1 hour. So I invite you to check it out with the link in the show notes here. Just click on the link. It'll take you to the webinar. You'll have to download the PDF and then just click watch. And you'll have an hour with me breaking down our 5-step process to help you make a vaginismus cure your reality. Thanks so much for watching, and comment below your thoughts on this video.